Welcome to another episode of Rockin HIT Sales, a quick podcast built around buyer side realities of healthcare. I'm David Hacker, your host and founder of Elevate HIT Sales. In each episode, I sit down with health system and health IT leaders to unpack what actually gets initiatives approved, implemented, and scaled. In today's episode, I'm joined by Marisa Farabaugh, Executive Vice President and Chief Supply Chain Officer for AdventHealth, a national health system that includes 57 hospitals across 9 states with more than 105,000 team members. This conversation is about what health IT companies need to understand about supply chain, standardization, evidence, implementation readiness, and what it really takes to move from a local win to a broader system adoption. All right, Marisa, welcome to Rockin HIT Sales. I really do appreciate you joining me today to help our listeners really better understand how health systems think about supply chain, vendor evaluation, and scaling solutions across an enterprise solution.
David, thanks for having me. It's great to be with you.
So we're just going to jump right into it. For listeners who may not know you yet, how would you describe your role and scope of supply chain at AdventHealth?
Well, I have the blessed opportunity to lead our supply chain as a chief supply chain officer for our organization, work with an amazing team. As part of my role, I also get an opportunity to help lead out in some of our pharmacy and ancillary areas as well. So we have a great team here. It's a wonderful organization, mission-driven organization, and look forward to sharing a little bit more about what we do here.
Okay, thank you. When a vendor walks into your office or into your team's office and they say, we're going to save you 20%, or we've got an ROI of 200%, what do you wish they would really understand about what actually drives system level value?
Well, maybe the first thing it would be, and maybe they do already understand this, but we get a lot of those emails and requests routinely. And so just understanding the sheer magnitude that come across sort of claiming to drive different percentages and value for the organization is there is a plethora. So I think sometimes I probably wonder if they might have an appreciation for the complexity of an organization and what all um, might need to go into those types of savings and dollars. And I think about if they've had experience in one healthcare organization, they've had experience in one healthcare organization, and so each one's a little different. And so sometimes claiming those very high numbers can be, uh, it takes a little bit of time to come through.
And that's kind of why I led with that question, because I know that you receive a vast number of 200% ROI savings or whatever their metrics may be. So that's why I kind of led off with that question. So in your world, what does operationalizing system-wide change really mean?
Well, I mean, we are a broad system. We are in 9 states, over 50 hospitals within our network, plus adding in the non-acute space, which is basically outside of the walls of the hospital itself. And so using the term organizational or system-wide implementation really means that whatever implementation we're making is happening across all fronts of our organization. We do a lot of local or regional type work where it makes sense. So hearing system wide has its own connotation that something is coming across uniformly across the entire organization.
How do you balance local autonomy versus system consistency without slowing everything down?
Well, that's a really great question. In fact, I think AdventHealth is quite unique in the way that we think about the answer to that. There are examples of probably holding companies and operating models, and we refer to ourselves as having a co-operating model, which means that decision making happens both with system level thinking in mind and also local level thinking in mind, and ensuring that the answers to the problem that we're trying to solve for, because we want to be solving for something, not just creating work for us, um, are are thought through on both fronts. It's really important to solve issues wearing both hats. And that answer that is derived when you are wearing both hats, when there's people at the table thinking about solutions on both a local and a system level, those solutions I think are the most powerful ones because they leverage the size and scale of an organization while also making sure that we're meeting our markets and our patients and our communities where they need to be met. You can't lose sight of either one of those things.
Now, what metrics really matter most early? What are those leading indicators versus later, the lagging outcomes?
Well, I think it depends on where you are in a project. It depends on what the project is that we're talking about. I think that, early in a project implementation, leading indicators are incredibly important. Making sure that you've got the right insights into how well that execution is going is incredibly important because you're starting up new processes. People around or people that are a part of these processes are having to learn new things. And it's really important that everybody's kind of on the same page as new processes coming out of the ground. So I think the earlier that you can see when and if there's any sort of opportunity for a little bit of correction or making sure that everybody's on the same page, that's great because it ensures that project's going to run more smoothly. But from a lagging indicator standpoint, I really think as the project matures and begins to really go live, those lagging indicators become more and more powerful as well. And I think in many ways, those become the standing KPIs for a governance group to continue to monitor and make sure that the program or project launch is working as intended months and years later after a go live. So both are really important. It depends on where you are in the project that I think you lean into one or the other.
Just to do a quick follow-up on that, would you find it advisable for the digital health companies that are going through something like that, that maybe during that ramp-up period or while they're trying to take everything live, that they identify what those metrics are as they ramp up over a certain time period? At month 1, they should be at this, or month 2, they should be at that. Would you think that would be advisable for digital health companies?
I think it's always important to have the voice of the customer included there. And so I'd probably expect that a partner who's on a journey with us brings their insights to the table and brings what they've seen other organizations with similar process or size or complexity, however they're gauging that, and work through those targets and expectations of the project with the customer. I think the customer needs to understand what they're being benchmarked against and what the expectations are from that partner working on the project and make sure that there's full alignment there. So having the conversation and being clear and creating transparency is an important part of a successful project.
From your experience and in working with different vendors, what's the most commonly misunderstood about value analysis and how decisions actually get made inside the four walls of a facility?
Well, David, I think again, every hospital system operates a little bit differently. And what falls within the purview of value analysis should be clear because I think different folks who might be listening to this would squarely fall within something that value analysis should cover and other folks may not be. It might be something that an IT group is covering or a different group is evaluating. As it relates to value analysis, so it's probably important to note that usually those folks are clinical in nature, right? So it is an intentional hiring of clinical team members to a team who now sit in supply chain, and they are there to help both sides speak each other's language, if you will. They come out of the markets and clinical spaces, and so they know how products are used. They know what are expected. They uh, they are, I think, a key aspect to the term value that needs to be um, carefully evaluated when thinking about supply chain decisions. Meaning, quality and cost together really make a value equation. And so sometimes deciding on the cheapest item may not be a smart decision because you'll use 5 times what you were using on a maybe a slightly more expensive item. That's the type of learning and knowledge and insights that we look to get from our value analysis team. These folks are usually sitting both at a central and a market level. They're helping lead a team of people in the markets at the facility, at a hospital, made up of people within those facilities and hospitals, usually clinical folks, usually physicians and nurses, to help create and give insights into the value of a certain product. And so it's a group of folks who help create process and standardization of how an organization can evaluate the value of new products or technology that comes into a facility in a systematic, unified, disciplined way. And you have the same types of conversations at all parts of the organization to ensure the same questions are being answered and you're thinking about it in a uniform way. So they're an incredibly important linchpin and very important group for supply chain, but they're also critically important because they're bringing a group of people together to weigh in on the relevance and value of something.
What's the fastest way that vendors can lose trust during an evaluation period?
Wow, I think when vendors are eager to talk and not to listen, when they don't necessarily understand the complexity of the customer that they are talking to. Again, every hospital is very unique, and understanding that complexity shows that they've done their homework, shows that they know what they're walking into. I think that when, again, there's a number put out on the table before there's ever been a need or a conversation, um, that doesn't really always incite trust either, because I worry that they have no idea how we work or operate, or what they would base those numbers on, what those assumptions would be based on. So I think that really creating relationships and building some trust and listening are really the places that if I were a vendor, I'd want to be leaning into.
Can you kind of walk us through how supply chains utilize anonymized price benchmarking in practice and where it's most useful and maybe where it can be a bit misleading?
Well, I think your comment about being anonymized is incredibly important. We don't share pricing and contracts from different locations. That's really an important aspect. That being said, benchmarks are important. It's also important to understand the context that the benchmark is being shared in. And so, a lot of times in supply chain, there's market share to be considered. So if you are 100% committed to one vendor in a certain category, you might receive different pricing than if you have with 2 vendors in a certain category. And sometimes when you look at benchmarks, that type of clarity isn't really coming through. And so I think that's an important aspect that needs to come along with the benchmark is, what are the expectations along with whatever benchmark it is that we might be looking at. I do think they're very important. They do help organizations ensure that the pricing that we're targeting or going after is reasonable and rational. I'll share that, there are times where an organization may decide not to go for the very, very top best pricing out there. And there's reasons for that. They want optionality. They don't want 100% market share. They realize that. And I think that realization and discussion and transparency with vendors on the provider side helps create trusting relationships on both sides as well. The recognition that a provider also understands what they're asking for is important.
Now, when a pilot goes well, do you see are there signals that it's ready to scale to a broader audience within Advent, or conversely, what are the red flags that we need to pause this for a bit and revisit?
Yeah, well, I think pilots are an important tool in the toolbox. Sometimes they're possible, sometimes they're not possible, but they can be very valuable in terms of projects that we just know there's a lot of testing and working out kinks in, and want to be able to create some time and space with a smaller group before really going live with a larger audience. I think that execution is incredibly important. When you start to, and having a very tight connected model with the market or location where that pilot is at is incredibly important. They are the ones that are really going to be able to send signals to leadership that, hey, things are working well or things aren't working well and we need to slow down. AdventHealth does an amazing job of listening to what's working in pilots and what's not working in pilots, and making sure that we've got it as right as possible before rolling out in a scaling aspect. And so I do think it's a very good tool to use, and listening to the voice of the customers is a critical aspect of it.
Now, Marisa, if you could give one piece of advice to a health IT founder who's trying to win and expand in the enterprise system, what would that one piece of advice be?
Yeah, I think having an open mind to how relationships get developed and built. I guess, again, realizing that leaders in healthcare organizations get approached multiple times a day by different opportunities. And how does one differentiate themselves is an important aspect. And I think the best way to do that is, again, by listening and building a relationship before trying to solve and say that there's a solution to solve for something.
The lightning wrap, which is my final two questions, are very simple questions with very short answers. Okay. What's one question every vendor should ask you early, even before they start pitching a solution?
I think they should ask, how does their solution help our organization? What problem are they answering?
And if you could complete this sentence, please. If you want your solution to scale beyond one site, start by.
Making sure it works incredibly well at the site that it's at.
Perfect. Marisa, it's been great. I thank you very much for your time. I'm sure that our listeners are really going to appreciate and get a better understanding in working through supply chain as part of their sales process. So, again, I thank you very much. Been very insightful. And I'm sure, again, our audience is going to really enjoy and walk away with a number of things that they may not have known before about dealing with supply chain. So, thank you.
Thanks for the time today, David. It was great.
Before we wrap up this episode, here are my three brief takeaways. Number one, big ROI claims do not create trust by themselves. Health systems need context, assumptions, operational reality, and an understanding of what it would actually take to produce those financial results. Two, value analysis is about quality, cost, and clinical reality. The cheapest option isn't always the best value. Supply chain relies on clinical input, standardization, and disciplined evaluation to determine what will actually work within their network. 3. System-wide scale starts with local execution. Before a solution can scale across an enterprise, it has to work incredibly well at the site where it starts, with clear metrics, customer feedback, and strong implementation signals. Have questions, comments, or guest ideas? Email me at podcast@elevate-hit-sales.com. Music, as always, is courtesy of Pennsylvania's finest, the Badleys. I'm David Hacker, and today I'm paying homage to The Who. So remember, if you want to move from a local win to a system standard, don't get fooled again by headlining big ROI claims early on. Listen first, prove value locally, and make sure the right people can say, I can see for miles before you try to scale.